Hi, I'm Dr. John Young, Medical Director here at Young Foundational Health Center here in Largo, Florida. When I see, we see a lot of new patients every day. And one of the first questions I ask them is, why are you seeing me? And it is surprising, as I think back over our history, that a large majority of them say this. I've been to the experts, I've been, at the big universities, the head of the department of neurology or whatever at a hospital, and they tell me there's nothing to do. So I'm coming to you because I hear you think outside the box. And I appreciate that. I'm glad that we have that reputation, that my nurse practitioners and I have a reputation of thinking outside the box. There is nothing wrong with these big institutions, the universities, the Mayo clinics, whatever. But sometimes in looking at a disease, you just need another set of eyes. And most of these institutions are looking at a lot of these diseases from what drug out there can I give you to get you better? And for a number of the diseases that I'm seeing in these people, these are incurable diseases. And they say there's really nothing to do. And I want to talk about two diseases that we've seen recently and how just looking at it from another perspective has really been very beneficial to the patients. One is a eye disease called NAION. Those are the initials. You could Google that. But it's really a problem with the optic nerve. And it swells and you lose your vision. No cure. They do try steroids, but if they don't work, it's good luck. And I had a patient come in who had been to the big institutions, and they said there's nothing to do. Nothing to do. So we here look at things a little different. We looked at the anatomy of the optic nerve. We looked at the biochemistry, what's happening in the neurons. And then we looked at the actual pathology of the disease. What does the disease process do to destroy the optic nerve? Took all of that together and just, maybe that's kind of a little gift that God's given me or whatever, but just looking at it in a different view. And what we did is, I think in the medical community, when you give a person a steroid, you think it takes care of all inflammation. It's not true. So we used a different type of drug that has some very strong anti-inflammatory aspects, gave it in a very unique part of the central nervous system, easily done. And 4 minutes later, this disease is reversed. Completely normal vision. We're working on making this last longer. Right now, the patient has to come back 2 or 3 times a year, and we repeat it, and it reduces we come back to normal vision. And we're trying some things out now we think are going to really help us. But just looking at a disease in a different perspective, and we brought vision back to a guy who was blind. Another disease is Retinitis Pigmentosa, genetic, rare eye disease. When you look at the retina, it's kind of gray, it's falling apart, no treatment. So once again, we looked at it from the genetic aspect and looked at what maybe could we do to get this disease to either stop progressing or actually improve their vision. Now this lady, she was 3 feet away from me, she couldn't even make out the features in my face. Tunnel vision, 50 years of age, no hope. And just breaking it down, looking at it differently, what we did is we figured out that maybe there was something we could do with that retina to stop the inflammation, the disease progression. As her partner said later on, he said, John, I thought it was a little weird the way you were going to treat my girlfriend. But I kept my mouth quiet. The way you did it was very amazing. And on the next day, she noticed, as we're driving to the airport, in the forest near the airport, 2 deer and a raccoon. She would have never noticed that. And the day after that, her vision was so much brighter and double the visual field. I mean, they are so excited because her vision is coming back. Now, I'm not saying we've cured that, but just in looking at some of these diseases in a different manner, you may be able to actually get better from some of these so-called diseases that have no cure. And I'm not saying we're curing everything or anything, but we're looking at differently, and we've been very pleased with our results.